On behalf of the Planning Committee, Administration, and moderators, we confirm no relevant financial relationships with ineligible companies exist for this activity. Presenters will disclose any relevant financial relationships or the absence thereof at the beginning of their presentations.
Welcome, everyone. I am your moderator for today, Maureen McCoy. I'm a teaching professor and registered dietitian in the College of Health Solutions and have been teaching at ASU since 2014. I am the dietetic internship director as well as the faculty advisor for the Pitchfork Pantry, which is a food pantry for ASU students and the surrounding community. My research interests include child and school nutrition, health policy and equity, and food insecurity. I'd like to thank you all so much for joining our Health Talks webinar brought to you by the College of Health Solutions at Arizona State University. Our college works to address the challenges facing people and communities to stay healthy, improve their health, and manage chronic disease. These Health Talks are one way we serve the community with timely and relevant educational information that also provides continuing education credit at no cost. First, this session is being recorded and will be posted on our website, asuhealthtalks.com. After the main presentation, we'll have about 20 minutes for Q&A, so please submit your questions using the Zoom's Q&A feature and not the chat box. Regardless of whether or not you've requested CEUs, please register your attendance today by using the self-check-in link posted in the chat so we have an accurate record of who attended today's webinar. Finally, for those of you attending live, we'll receive a brief survey asking for your input about today's webinar. If you're requesting continuing education credits, this must be completed in order to receive those credits. If you did not apply for CEUs, we would still love and appreciate your feedback to improve our series. So now for our amazing speakers today, I'm so excited to introduce our speakers, Dr. Carol Johnston and Punam Ohri-Vachaspati. Carol Johnston is a professor and senior associate dean of faculty success in the College of Health Solutions at Arizona State University. She is a registered dietitian and an expert in vitamin C metabolism, the medicinal use of vinegar, high protein, low carbohydrate diets for weight loss, and vegetarian diets. Carol has published over 150 research articles and book chapters focused on the impacts of functional foods, botanicals, and nutrients on human health outcomes. Dr. Punam Ohri-Vachaspati is a professor of nutrition at the College of Health Solutions at Arizona State University, where she leads the ASU Food Policy and Environment Research Group. Her research examines social determinants of health, specifically in low-income minority communities. She studies the impact of federal, state, and local policies in shaping food and physical activity environments in school settings and in communities, and recently spent a semester at the World Health Organization in Geneva, Switzerland, working with the Nutrition Division in the Action for Food Systems Unit. We are so fortunate to have these amazing health experts with us today as we explore understanding the new food pyramid, insights from nutrition experts. In today's discussion of the new food pyramid, these leading health experts will share insights on the changing guidance for daily diets. They'll explain how nutrition science has evolved over time and what it means for maintaining a healthy diet today. We hope that you'll leave today with a better understanding of what's happening with current nutrition recommendations and policy. To start off today's group presentation, please welcome Carol Johnston.
All right, let's see. Oh, I know what I needed. I'm sorry. Sorry, everyone. I just have to get myself set up here. Okay, well, thank you, Maureen. This is great to be here. I'm excited for the talk, but I'm gonna get right into it because we have a time limit. I have no conflicts of interest to disclose. And I want to start at the beginning. So the birth of nutritional sciences. And so you have to remember it's a science. And so there had to be analytical techniques available. And it wasn't until the mid 1800s, late 1800s that our scientists had the techniques available to isolate and characterize nutrients. And so this first happened in the mid to late 1800s. They isolated proteins, fats, and sugars, and they started to understand their role in energy production. They were able to understand how calcium and phosphates participated in bone mineralization. And then as their analytics improved and they got more sophisticated, they were able to identify much smaller molecules, and these we now call the vitamins in the micronutrients. And not only did they identify these small molecules, but they also started to understand that they were very important in our health. And many of the conditions that plagued humanity for thousands of years, they now understood had to do with what we eat. So as they discovered them, they called them A, B, C, D. So vitamin A deficiency causes blindness. The B vitamins are important for mental health. Here you have the dermatitis and the dementia with the pellagra, scurvy. Everyone's heard of scurvy and how millions and millions of people have died over the thousands of years from scurvy. And then, of course, vitamin D was rickets, bone deformities. And so as they understood how these related to health, it was breakthrough. And we actually, many Nobel Prizes, I think a total of 17 Nobel Prizes in the early 1900s were awarded to these scientists because these discoveries were just they were breaking discoveries and they improved our health quite immensely. And then once the government figured this out, the importance of these nutrients, our government started fortifying our food supply. And so in 1924, iodine was first added to salt, and goiter, which was rampant in the US, fell from about 40% to 9%, very quickly once they started iodizing salt. In the 1930s, they added vitamin D to milk, as well as vitamin A and vitamin A to margarine, to fats. And they literally eliminated, deficiency rickets. And so these are, such important health landmarks. In the 40s, they started to enrich and fortify our grain products with the B vitamins. And this alleviated major dementia issues that our population were dealing with. And if you look at the diagram, you can see when they started enriching, you can see how the dietary levels of these B vitamins increased. And on the right, you can see how these deficiency of the B vitamins, death was a consequence. I mean, these were serious rickets, scurvy, pellagra. These were major health concerns, and we pretty much eliminated them, which was pretty amazing. And the government understood that, okay, we need to educate people. We need to educate them on how to get these nutrients. But you can't just tell a person you need more vitamin A, you need more vitamin C, because the general population doesn't know where these nutrients are in food. And so that was sort of the birth of the food guides. So the concept here was, let's tell them which foods to eat because they can understand that. And so this is our first food guide. And if you start at the top, you can see that they're saying, okay, we need you to eat green and yellow vegetables because that's where the vitamin A is. And then as you go around, you can see group 2 is the oranges, tomatoes, the citrus, and the cruciferous vegetables, because that's where the vitamin C is, and there's also vitamin A there. And then you keep going around, you can see the milk. We need you to drink milk every day because that's where the calcium is, and then they fortified it. So you had the vitamin D there. You need the protein for to build body structures. And then the carbs, the grains were necessary for energy production. And so they were translating in a very basic manner. They were translating this very complex information that the scientists were gathering, and they translated into something that is actually quite informative. And so this was very helpful. In the 1950s, they took these and they condensed them into what we call the basic 4 food groups. And so as a child born in the 50s, I was raised on the basic 4 food groups: 2 milks, 2 meats, 4 vegetables and fruit, and 4 breads. And you can see that they do provide information there. They don't just say drink milk, eat meat. They tell you how much and which life cycle this is important in. And if you note in the cereal group, even back in the 50s, they were promoting whole grains. Even though they enriched the grains that had been refined, they were still promoting whole grains then. And the vegetable group still retained the information that you need to eat a variety of vegetables, not just a single type of vegetable, not just apples. Okay, we need you to eat from these different food groups. And so, this is very informative. But what you have to remember is life expectancy back in the 40s and the 50s was only in the upper 50s. Okay, and so chronic disease was not on the mind of the government or the scientists necessarily, because life expectancy just wasn't that long. Chronic diseases usually start to really manifest in your 50s and 60s and 70s. And sure enough, we started to see this increase in heart disease as people started to live longer. And one of our early, most eminent nutritional scientists, Ansel Keys, I mean, this is the stuff I learned when I was in school. He was a big influencer in the nutrition world. And he was an epidemiologist, and he published what is called the 7-country study. And he was the first one to link saturated fats with heart disease. And he published quite a bit of data on this. And as you know, those are correlational data. And it's really interesting because at the time, the World Health Organization was a little skeptical on this because they said, this is circumstantial. It's not a causal relationship. But our government picked up on this, and they made a pretty broad sweeping recommendation was we need to lower the fat in the American diet. Okay. And you can see the protein level sort of just stays the same. And so something had to replace those calories. And so what replaced those calories were grain. Okay. And so it's really interesting. I give you the quote from Mark Hegsted, who was another eminent early nutrition person, in front of the Senate. He said, what are the risks associated with eating less meat and less fat and less saturated fat and less cholesterol and less salt, less sugar, and eating more fruits and vegetables and cereal products? What could be the harm? And so again, not a lot of science perhaps here, although these are well-renowned scientists, but the evidence base probably was a little shy of maybe what was necessary. And so if you follow the black line, you can see that this policy promotion was hugely successful, okay, because saturated fat intake dropped dramatically over the course of time. But I just want to point out that, now we have some other issues that were increasing. And again, this is all correlational, circumstantial, but we started to see this obesity increase. And so a lot of nutrition experts at the time were saying, this is a grain, this is a carb that's causing this. But we all know, as nutritionists, and myself included, I've run clinical trials, you can lose weight on high carb, low fat diets. Okay, so it's not the high carbs that are causing the obesity. It's most likely the calories. And so in the same time frame, we have a lot of new processed foods coming on the market, lots of snacks that weren't, again, I'm a 50s baby. We didn't have these kinds of foods early on, but as you got into the 80s and the 90s, lots of snack foods. And so this is probably an issue of just overeating. And so in 1992, we had our first pyramid, and this pyramid is still promoting the grain as a base of the diet. And so when this pyramid came out, it was promoted that grain should be the base of your diet, and then fruits and vegetables, and then several servings of meat and dairy. And so you can still see the you sort of still see the basic 4 here, but instead of 4 servings of grains, we're up to 6 to 11 servings of grain. Okay. And then in 2005, there was a little bit of recognition, maybe we don't need so many grains in our diet. And they actually reduced the recommendation down to 7. And you can see the percentage of the pyramid now for fruits and vegetables is quite solid. And so this is sort of how they progressed along with the research that was being conducted. And then in the Obama era, we got our My Plate. And now the grains are down to 5. Okay, so it's just interesting how they've promoted the fruits and vegetables to a higher degree and less grain, while the protein pretty much stays the same in all of these renditions of our food guide. So all this is interesting. Um, and then now we have our brand new food guide, um, Eat Real Food. And so that message is actually a pretty good message because we have I believe it's 70% of the food consumed by Americans is processed, ultra processed foods. We've heard a lot about this. And so the Eat Real Foods message, I think, is a good message. And they inverted the pyramid, there's things to be said about this where the proteins are on the top along with the fruits and vegetables. And then you can see the grains are down at the bottom. And if you read the text that goes with this, this is sort of what this is what they're recommending as far as serving sizes. So instead of 2 and 2 for the meats and the dairy, now it's 3 and 3. So there's a little bit more emphasis on animal products, perhaps, or fat, animal fat products, I should say. Vegetables and fruits are at 5, and then the grains are down to 2 to 4. So we're sort of back to the basic 4 when you look at the grains, and they do promote the whole grains. Other things that are in the text that goes with this is prioritize protein at every meal. Well, there's an evidence base for that's growing, that we do need to have good, solid protein sources. I think perhaps having a steak with the fat on it might not have been the best graphic to put here, because you can eat animal proteins and not have the fats. And if you look more at the text, you can see that it does actually say include full fat dairy, but it also says limit your saturated fats to less than 10% of calories. And so in order to do that, you really need to consume lower fat meats and maybe more of the plant-based proteins, and more of the low fat dairy to be able to accomplish that. And interestingly, they talk a little bit about fermented foods, which I think is really great. As we know, the microbiome is now emerging as a really important aspect of health, and so we want to feed our microbiome. But I do want to point out that there are still issues with this food guide, and that is that scurvy is on the rise. Okay, so this is a 2024 study, and it's pretty shocking. Pediatric scurvy has tripled just in the recent decade. And if you look at adults, you can see that based on national data, you can see that deficiency is as high as 8%. And then there's hypovitaminosis C, and then there's inadequate levels. And if you put all of this together, you're almost at 50%, especially in the male population, with inadequate vitamin C levels. And so I think we need to be more informative to the population. We need to tell them which, like the first guide told us, you need to have citrus, you need to have tomatoes in your diet. Because if you eat the most commonly consumed fruits and vegetables, you're not even at 60 milligrams a day, and the RDA for vitamin C is 90. And so we need to educate people that it really is important which fruits and vegetables you consume to make sure you cover these nutrients. Another concern that's rising or becoming, sort of emerging is riboflavin deficiency. So this is a B vitamin that's very important for B vitamin metabolism. It allows B6 and B12 and folate to operate correctly. It's very important in energy production. It's important for cardiovascular health. And you can see in Canada, half of the population is deficient. This is unacceptable. We know how to fix this. And so this in the US, we do enrich and fortify. And I just want to, acknowledge that this is very important, that we are fortifying our food supply, because some of these nutrients we just need to make sure people are getting, because they have such devastating consequences if you don't have them. So I think the take-home message is that, these food guides need to not only instruct visual proportionality, perhaps, but they should also instruct on specific foods to make sure that deficiencies are covered, because these nutritional deficiencies compromise health dramatically. You might not die of scurvy, but you might feel very lethargic and bruise easily and have exercise, don't want to exercise. There are consequences of even subclinical deficiency states in these nutrients. And I think that the evidence base is very important. And I really do like the 1940s. I do really like the 1940s food plan. I think that it's very important, and that they identify specific foods and provide a little bit more detail. All right, well, thank you.
Thank you so much, Carol. I also really enjoyed the 1940s version. I'm like, oh, that was lovely. All right, just as a reminder, if you haven't done so already, please register your attendance using the self-check-in link posted in the chat so we have an accurate record of who attended today's webinar. All right, next we will hear from Punam Ohri-Vachaspati.
You're muted.
Can you all hear me?
Yes, we can hear you now.
Okay, great. Thank you, Maureen, and thank you, Carol, for setting such a wonderful stage for my presentation. And thank you for the historical perspective on how food guides and now dietary guidelines have emerged over time.
Punam, real quick, we're seeing your presenter view, not the audience view.
This should fix it.
There you go. That looks good.
Okay,
Thank you.
great. So as Carol mentioned, we've had different versions of dietary guidance going way back to 1940s. But starting in 1980s, we started developing these what we call dietary guidelines for Americans. And they have been updated every 5 years since 1980. And the dietary guidelines for Americans, which I'll refer to as DGAs throughout, are really the cornerstone of federal nutrition policy and nutrition education activities that happen in clinical settings, in schools, and so on. So the first set of these official dietary guidelines for Americans were established in 1980. And each iteration of them usually has a message attached to it. So the first one emphasized eat a variety of foods. Along the way, we had in 2015, My Plate and Healthy Eating Patterns, to eating patterns at every life stage. And then the most recent guidelines of 2025, 2030, as Carol mentioned, talk about real food. Take this out. Yeah. Eat real food. So these dietary guidelines are pretty extensive. These are large documents which synthesize research and are updated based on the most current research. And that's the whole genesis for revising them, so keep them current with research. In addition to the dietary guidelines, we've had occasions when we've tried to visualize the dietary guidance, right? Carol shared some of them. So way back about 34 years ago, we had the first food guide pyramid in 1992, which Carol described. In 2005, this dietary guideline visualization was updated to a more interactive system called My Pyramid that also incorporated physical activity aspects to it. This was not easy to follow, and it was way too abstract for people, so it didn't last very long. And then we came upon the 2011 my plate during Michelle Obama's and Obama administration. So this was a simplified visual that has been used since 2011 till now. So it's been about, 20 some years that it's been used. And no, I'm counting it wrong. It's about 14 years that it's been used. And now we have our new pyramid, which is, when this was brought up, it was called that we've inverted the pyramid that we've been using. But I just want to focus on that this pyramid, the 1992 pyramid, had been kind of decommissioned for quite a while, so we weren't quite using it. So this new pyramid is actually not inverting a new pyramid, the most recent pyramid. The most recent guidelines were my plate, but we did in this, in the 2025 iteration, inverted a pyramid, and I'll walk you through some of the changes that we've seen. But before we get to that, I want to kind of set the stage for how dietary guidance is created, to kind of talk through a little bit of the background and a little bit of the politics of it. So dietary guidelines development process, as I mentioned, happens every 5 years. So now that we just had our dietary guidelines released in 2026 January, the HHS and USDA is probably already working to develop scientific questions for the next set of dietary guidelines. Once the questions are determined, the Dietary Guidelines Advisory Committee is nominated and appointed, and that's a really big thing in the nutrition field. This Dietary Guidelines Advisory Committee is a select nutrition experts in various fields who are vetted extensively, both for their expertise, but also for their affiliations and funding and all of that, because there is a huge, this is food, so industry is heavily involved in it. So they're vetted for their associations with the food industry, their funding, and as I said, their expertise. Then the Dietary Guidelines Advisory Committee reviews the evidence. They take about 2+ years to go through an extensive review process of what has happened in nutrition research since the last dietary guidelines were created. So as part of that, they do analyze data. For those of you who are familiar with NHANES, the National Nutrition and Health Examination Surveys that collects data from Americans on an ongoing basis to see what we are eating, where are the gaps in our diets, and so on. So they to understand food patterns, right? How are we eating? What is the food pattern that people are following, so that when recommendations come out, they make sense in terms of what's available in the market, but also fills in the gaps for what is happening. Carol brought up some issues about more recent evidence showing riboflavin deficiency or vitamin C deficiency and such. So they look at all of that, how much are we consuming? How does it compare to the recommendations? And then they do a very thorough systematic review of the evidence. And based on that evidence, then the Dietary Guidelines Advisory Committee hosts public meetings to present their results based on the review of that evidence. Using all of that information, then they produce what is called the scientific report, the Dietary Guidelines Advisory Committee scientific report that is reviewed by peer reviewers and commented upon, and I've been part of those groups that have commented on. They then pass it on to USDA and HHS, the Health and Human Services, to develop and implement dietary guidelines. I just want to note that all of these 4 steps or 5 steps that I described are open to public until this year. But the dietary guidelines, the development process is not open to public, and it is behind closed doors. So sometimes we refer to it as it's the black box. Once we have the dietary guidance report, then it goes into a black box and we come up with the guidance, the guidelines. So in 2017, the National Academies of Science and Medicine reviewed the dietary guidelines process, and what they came up with, that this process had to be it had to have scientific rigor. That was essential because this criteria guides the conclusions that the Dietary Guidelines Committee comes up with. Transparency and building trust was critical, because without that, the validity or the trust of the people, trust of the agencies is not there. Similarly, conflict of interest. As I mentioned, there are likely conflicts of interest, and it's not just enough to disclose them, but they have to be managed in the process of development process. And again, the process of credibility is important, because without that, you lose public trust. And if you want people to follow these guidelines, both at individual level or at policy level, that's not going to happen. So scientific rigor and transparency are critical for developing these guidelines. And the reason is that food industry, which we consume food all day long, we as a country, we spend about 2.5 trillion on food, away from home or at home. So there are lots of stakeholders that are interested in what comes out in the dietary guidelines. So this transparency and rigor becomes really critical and important. So I just want to spend a minute or two to talk about the difference between the Dietary Guidelines Advisory Committee report and the dietary guidelines themselves. So the Dietary Guidelines Advisory Committee report that I just described is an overview of the latest research. It is developed by the Dietary Guidelines Advisory Committee, and the intended audience are USDA and HHS. And it is used to develop the dietary guidelines, right? That's where it ends. We, as researchers, we use it extensively. The dietary guidelines, on the other hand, are recommendations for average Americans should eat or drink or to promote health and prevent chronic disease. DHHS and USDA write these guidelines. The main audience for this are nutrition policymakers and health professionals. These are not intended for these. This is not a public-facing document, though the visuals tend to be. So these, as I said earlier, are used as the basis for nutrition policies. Your school food programs, SNAP, WIC, programs for the military all rely on this dietary guidance to develop policies and programs. So I just want to briefly walk us through the brief history of evidence use in dietary guidelines. As I mentioned, the first report came out in 1980. Before that, there were some nutrition goals that were developed by a Senate Select Committee. But the first guidelines came out in 1980, and starting in 1985, there were laws written that required that these guidelines be developed every 5 years, and they be informed by the Dietary Guidelines Advisory Committee. And that was the case. All these red dots, as you see, we make the 5-year leaps, and then they're consistently guided by the Dietary Guidelines Committee. Along the way, we have different visuals. Till we come to 2025, the USDA and HHS, we had a Dietary Guidelines Advisory Committee. They did come up with a report for the 2025-2030 guidelines, but their recommendations were rejected by USDA and HHS because they had emphasized equity and plant-based dietary patterns and de-emphasized animal sources. So instead, they then shaped these dietary guidelines using a scientific foundation report, which we didn't know about till the dietary guidance came out. So if you recall, I talked about the transparency in the process that was missing when the new dietary guidelines were developed. So we did get this in the Scientific Foundation for Dietary Guidance report. We did get people's conflicts of interest, but that came after the guidelines were developed. And we have no idea as to how these conflicts of interest were managed during the Dietary Guidelines Foundation development. So the issue is bias. They acknowledged that there were biases with the dairy industry, with the beef industry and others, but they did not talk about how did they manage these biases. Nobody knew who were on these committees till much later in the game when the dietary guidelines were. So this is a departure from the norm, how dietary guidelines had been developed in the past. So that has affected what the dietary guidelines are. So, Carol showed us this beautiful clip art image that is our new dietary guidance. So there are several areas where evidence is lacking in terms of what is promoted. So one thing I really like that Carol emphasized also, that they're talking about eating real food. And that's such a wonderful, strong message. And I think that needs to be reiterated. But there are areas where there isn't really strong evidence to support the guidelines. For example, there is emphasis on healthy fats, for example, beef tallow, and there is no evidence for that in the literature. Vegetable oils, specifically seed oils, are notably missing from the guidance, even though we know that they are healthy sources of essential fatty acids. There is hyper-emphasis on protein foods, which is not necessarily justified. Americans already consume way more protein than what is currently recommended. And there is another august body that determines what our daily requirements for protein are, and it's not really the dietary guidelines task to kind of come up with new recommendations, because that creates more confusion. The emphasis on animal protein, as you can see on the top left, and especially red meat, is contrary to well-established evidence, and a lot of organizations are coming up and speaking about that. The emphasis on full-fat dairy, they recommend about 3 servings, but if you took 3 servings of whole milk, you'd get to about 10% of your calories coming from saturated fats, which is what is recommended in these guidelines also. So there is some contradictory guidelines. Whole grains and fiber get demoted in these guidelines, even though we know that as Americans, we consume far fewer whole grains. There are areas where these guidelines agree with evidence, and those are emphasis on fruits and vegetables, though the recommendations on variety is missing, and I'll show you in the next slide. De-emphasizing highly processed packaged foods, we really commend these guidelines on de-emphasizing that. And then limits on sugar, though some of the recommendations, one being that no sugar under 10 years of age, can be challenging, specifically for school foods and school meals. And we need to adjust our marketplace for that. And also limits on salt are evidence-based. Limit to saturated fats, these are consistent with prior guidelines of limiting it to 10%. And here, I just want to compare the guidelines from 2020 to 2025 to show where some of the differences are and where the similarities are. So the vegetable guidelines remain pretty similar, except we don't have any guidance on variety. So as I mentioned, these guidelines are used for school meals. So if I was facetious and I said, okay, I could offer potatoes all 5 days in school meals, I would still be meeting those guidelines. So there is no guidelines on, and I just want to remind people that Carol talked about, right? It's important not only to eat vegetables, but which kinds we are eating. So that guidance is missing. Another one that's missing is different is that there is no guidance, recommendation for refined grains, which is wonderful. Just a reminder that all of our fortified grains tend to be refined. So if we're going to continue to prevent the deficiencies that Carol mentioned in her presentation, we'll have to rethink what grains we fortify. And then protein, I've talked earlier, protein recommendations are significantly higher, and the oil recommendations are different. There is emphasis on some of the fats which are not really healthy, and then some of the so there is a little bit of misinformation. Olive oil, for example, doesn't have essential fatty acids in it. So these are the key messages from the dietary guidelines, and they are consistent with some of the previous recommendations. Eat the right amount for you in terms of calories, prioritizing animal protein at every meal, though the emphasis here is on animal proteins. Similarly, on dairy, emphasis being shifting to full fat, fruit and vegetable throughout the day, incorporating healthy fats. Whole grains are emphasized, but they are now at the bottom of the pyramid. And then the limits on highly processed foods is really welcome. The great emphasis on that is welcome. There is limits on alcoholic beverages, but no quantities are described. So I don't know if I have a few minutes to just briefly go through. Can I do a time check with you, Maureen?
You are at time, so
Okay.
maybe 1 to 2 minutes.
1 to 2 minutes. That's great. So I work in the school food space. So as I mentioned, these dietary guidelines have major impact on how we implement our food assistance policies. So if the dietary guidelines, and there is a USDA requirement that the school meals align with the dietary guidelines. It takes a little bit of time for USDA to come up with the guidance for school meals. But if the USDA was to use the current dietary guidelines to align the school meals with them, so there would be shift towards whole meals, limit highly processed foods, favor scratch cooking, which means higher cost of food, higher labor cost, and higher equipment cost. Emphasis on protein from animal sources would also again mean higher cost for food, may reduce diversity of offerings from plant protein foods. The recommendations on added sugar restrictions, no amount of added sugars for 5 to 10-year-olds will mean that be some challenges because sugar, as you all know, is in pretty much everything right now. This recommendation for saturated fats versus whole milk recommendation will be challenging given the saturated fat limits on the school meals, even though there are some exemptions in it. And then the de-emphasis on variety on fruits and vegetables will be kind of a loss for this whole salad bar movement in school meals. So this creates challenges because a survey done with the School Nutrition Association's members prior to the guidelines shows that cost, labor, and equipment were big challenges. And the dietary guidelines, new dietary guidelines will actually increase the cost, the need for upgrades to kitchen equipment, need for staff training, which are all wonderful. We need that. But that means the question becomes, can school meals meet the new dietary guidelines recommendations without any additional funding? So that's the question that we are all going to be grappling with in the coming years. But I do want to leave you on a lighter note. I don't know if you've seen, I'd urge you to check out your grocery stores. I have started seeing a lot more junk food with high protein content. So you've got these chips with high protein content, these Pop-Tarts with high protein, even though they have 30 grams of sugar in them. And then beef tallow is available in many, many stores. And then this local restaurant sells a 42-ounce steak with molten beef flavor, beef tallow on it. So just some things to consider. Dietary guidelines have implications, and we are seeing some of the results of it. So thank you.
Thank you so much, Punam. That was wonderful. And Carol. So let's move to the Q&A now. All right. So first question, and I think you both can perhaps touch on this. So Punam, you specifically noted that there are some parts of the guidelines that are not necessarily evidence-based. How can practitioners help interpret and communicate these recommendations in a way that maintains scientific integrity and public trust? And if you both want to comment on that, feel free.
Yeah. So I think keeping the focus on real food is really, that's going to help us to say, cutting back on ultra-processed foods, focusing on fruits and vegetables, focusing on varied sources of protein, not just emphasizing animal sources of protein, especially not the red meats or the fatty red meats. So I think taking what's best in these guidelines and adapting that in practice is great. There are many organizations that are coming up with some modified versions of these guidelines, and I'm not a big fan of those because then it creates more confusion. but using these guidelines in the My Plate format, right? As Carol kept referring to the basic four or the basic five as the My Plate recommended, and keeping the focus on real food, minimizing ultra processed foods would be a good way to go about it.
Yeah, I don't really have anything to add. I totally agree with what Punam said. Focus on real foods, focus on plant foods as much as possible because there's where the fiber is. That's going to support your microbiome. And I would take the positivity side of this, the positive things and try not to be negative.
No, it's great guidance. I know it doesn't do any good to focus on the negative. That hasn't gotten us anywhere. When we look at the progression of all of these lovely models, which I love seeing the pictures from the 40s and every kind of progression we've had since then, do you think that anyone paid attention to these more so back in the 40s than they do now? Like, we keep coming out with these new iterations, and it's like, well, does the public actually look at this and follow this?
I totally think in the 1940s, it was a totally different scenario because those people had friends and family who died of some of these conditions. Pellagra was rampant and it caused a dementia, and people were put in insane asylums. They think, as many as half of the people in these insane asylums had pellagra. And so they were aware of these conditions. And so it was miraculous when they learned that they could just eat these foods and not get them. So I think there was a lot of attention on this. My parents were born in the 20s, and so they experienced a lot of this. And so I was raised with a mom who there was citrus on that table. She very much followed this because she experienced a lot of this. She saw it firsthand. And now I think our people don't see this. They don't understand the history and the importance of it. And the fact that as many as 50% of our men out there might have inadequate vitamin C levels is pretty frightening. And you're not going to die of scurvy, but you're going to have the health impact of having low vitamin C, which, like I said, is lethargy. And so if you feel tired all the time, you're not going to exercise. Okay, and it affects your brain, and so even having subclinical deficiencies have dramatic impact on your health, and we just don't really talk about that. We talk about protein, we talk about carb and fiber, and I think most people could probably give you a rational response to how much carb and sugar you need to be consuming, but they just don't have a concept of these micronutrients.
If I can just add that, yes, we've changed these images or how we visualize our dietary guidance. The challenge is that most people do not follow these guidelines. Most people are not aware of it. In fact, when I've given similar talks, I often ask people how many people had even heard about dietary guidelines before this time around. And most people have not, right? Because this hasn't been part of our discourse. So one thing I really like about the current guidelines was that many people are aware about it. Many people are aware about that these guidelines exist and how to adopt them. So I think the challenge is that these guidelines are not as visible to the normal population. And they need to be integrated more into whether we are educating or in clinical practices. And people do use, right? The dietitians do use some of it, like the My Plate was used in clinical practices often. But I think there is less following of these guidelines than we would like to see. They do form the basis for our federal policy. So the recommendations on fortification and all of those are recommendations for what to include in school meals or in our WIC program and so on. Comes from this dietary guidance, but in terms of how many people are following it or how many people are which image appeals, these tests are done, right? The My Plate was extensively tested, and found to be something that was easy to interpret and adopt. I don't think the current image was tested as extensively with the populations.
Yeah, that's true. If nothing else, it's brought it into the conversation and people are talking about it. So that's what's one positive thing. I appreciate the positive outlook. And it is interesting in the 40s it was a matter of life and death, and now it's a matter of like how well can I live with chronic disease? And like how many years can I go on with that? And maybe I'm okay with that, but my life could be a whole lot better if I did follow these things. Thank you. All right. There was a great question. Okay, so here, when and how did special interest lobbies start getting very influential in this whole process?
So it starts with the who's nominated to the Dietary Guidelines Committee, right? So that's why that vetting of that process is very important. And so that's why the transparency on the first 5 stages that I talked about is really critical, so that the evidence that's coming into the formation of the Dietary Guidelines Advisory Report should be as clear and as concise and as unbiased as possible. So that's the critical phase. Now the influence comes at all stages, right? In terms of who's nominated, who's serving on the Dietary Guidelines Committee, though it's become much more rigorous now. And I think the last Dietary Guidelines Advisory Committee had really, last few have had very little in terms of conflicts of interest, and they've been managed in various ways. But the influence also happens in the black box that I was talking about, right? Once the Dietary Guidelines Advisory Committee report is forwarded to USDA and HHS, we don't quite understand that process fully as to how that scientific report then is converted into the dietary guidelines for Americans that we see in the final report. So that's where there is potential for influence from various stakeholders, because there is a lot at stake, right? There is from all aspects of the food industry, from the food chain, there is potential interests that are weighed into how the process works.
Okay, great. And that is why we're seeing so many high protein foods pop up.
Yeah,
now.
I mean, you saw that, right, in the conflict of interest list that I shared. A lot of people from the beef industry, meat industry, and there are others, right? So there is influence of that, and you see, you see it in the visual. You see it in the don't see as much of it in the text as you see in the visuals.
Right. Yeah, and it's important to go past the visual, because the actual numbers and guidelines that are associated, like you mentioned, like it doesn't equate to the way that the pyramid is set up, where we think of, big to small. So definitely look at the amounts that are noted as well. All right, another question. What are the main challenges in implementing the new food pyramid at a public health level, particularly in low resource settings?
Yeah, I can take a stab at it and then pass it on to Carol. So I mentioned, what the implications for the school food programs, for example, right? So these school food programs are intended for all kids, and some of our children get the meals at reduced price and some get it for free. But the budget for these meals is really small, right? The dollar amount at which USDA reimburses schools for these meals is very small. So if these guidelines are to be, we still don't have USDA guidance on how this will impact the requirements that schools have to follow for school meals. But if some of the examples that I showed come to fruition, without increasing the reimbursement rate for school meals, it will be very difficult for schools to meet these guidelines. Similarly, when we talk about programs such as SNAP or WIC, where we are making these recommendations based on the dietary guidance, now if the guidance is so much red meat forward, that is expensive. That's probably the most expensive thing people buy on their in their groceries. So if the benefits for some of these programs, whether it is WIC or SNAP or other programs or programs for our military, if they don't change, then following these guidelines becomes almost next to impossible, because it's difficult to make room in your food budget for these kinds of items that are so expensive and that are being promoted right now.
All right, as we go into our last few minutes here, could each of you give like the basic consumer, what should we do with these guidelines? How do we move forward with this?
I guess I am such a simplistic person. I think we just need to discuss the food groups based on their nutrient content. So when I talk about the food groups, I emphasize the nutrients that are in those food groups and the importance of getting those nutrients. And I'm a vegetarian, and so there are a lot of people out there moving more towards a plant-based diet, and these guides don't really give you a lot of good information on how to approach it if you're not eating meat and maybe not eating dairy. And so again, you need to know who you're talking to, and I just think you need to be positive about this, that we do need to eat from each of these food groups. And there's good choices and there's bad choices from each of these food groups, and we want to focus on the most nutritious sources there, and we want to think about caloric intake. And I see in the questions, there were quite a few questions about exercise. I think, the one pyramid with the guy running up the steps, I mean, that was to emphasize the importance of being physically active. And so I think that's important. And there was another question about water. And I think that's important as well. And that's not really, none of this, the exercise or hydration is portrayed in the newest pyramid. And so I think, as nutrition professionals, we need to talk to the people about the positive aspects of this, and know who we're talking to, so we can focus on their, what their needs are. I think that's really important when you're speaking to the public.
I would just add that, keeping the focus on real food, cutting back on processed, ultra-processed foods, cutting back on sugar and salt, which these guidelines really come out strong on. Those are really positive aspects that we should focus on. And then keeping the focus on whole grain and fruits and vegetables. Those are the elements that we know are associated with reducing chronic disease risk. Those are the elements where we are not consuming enough. So kind of, shifting away from talking too much about the protein, which these guidelines heavily focus on. I would focus on really reducing ultra-processed foods, salt and sugar, and those salt and sugar do happen to be more prevalent in these ultra-processed foods. So keeping it on real food, fruits and vegetables, whole grain, and I think we'd be in a much better place with that.
Thank you both so much. That was a fantastic talk to level set us on where we are with the dietary guidelines. So that's all the time we have for today. If you've not done so already, please register your attendance using the self-check-in link posted in the chat so we have an accurate record of who attended today's webinar. We encourage you to follow the College of Health Solutions on social media, where you'll learn about other opportunities just like this one. Our Health Talk series continues in July, when we will be discussing heat and hydration. So details and registration will be available at asuhealthtalks.com. Thank you again, and have a great rest of your day.